Good evening, my subscribers. Welcome to my YouTube channel. Those who have not subscribed yet, subscribe, put on a notification. Today I've come to discuss about leiomyomas. We also call them leiomyomas or fibroids. I've been getting a question from my subscribers to tell them more about fibroids. They are non-cancerous tumors that develop in the uterus of the female, as you see here. Some of them can be small at this size, and others can be big to the extent of prolapsing and come out of the cervix. This is your cervix, and this one is your vulva. So, what are the common signs and symptoms that you have these things? One of them is backache. You will be experiencing backache. Two is abdominal fullness, mostly in the lower abdomen. You'll be getting abdominal pain. Three, you will be getting irregular bleeding from below your vagina, and it will be heavy bleeding. So another thing, they can interfere with your fertility, so you'll be not in position to raise babies. You get miscarriages, you get premature abortions. So what are the types? We have 5 types of these fibroids. One of them is what we call epidermoid, because it has a stalk. It can grow inside the uterus, or it can be outside the uterus, as you see here. Another one is intramural. This one grows within the walls of the uterus. We have what we call the subserosal. This one grows just in the uterine wall, just outside the uterus, but it can grow inside the uterus as it grows in size. We have what we call submucosal, just in the uterine lining, inside the uterus. We have what we call the intrauterine. This one grows within the uterus. So, when you look at them, they might appear to be simple as you see here, but they can become complicated. So we are going to see how can we treat them and what causes them in our next episode. So, we have been looking at our uterine fibroids. Now, we are going to, in our part 2, we are going to look at the causes and treatments. One of the causes is what we call estrogen. Estrogen is a hormone in ladies, and this hormone, in most cases, comes during your menstrual period, when you are towards ovulation, and it maintains when you get pregnant. So, estrogen has a tendency of increasing, promoting the growth of these fibroids. Secondly, age. For ladies who are below 35 years, when you delay to give birth, waiting for 30 years, you are at the higher risk of getting these fibroids. Another thing is a genetic factor. When you have a history of fibroids in your family, you are most likely to get these fibroids. Another one is diet. When you feed on a diet which is low in vitamin D, or which is high in red meat, you are at a higher risk of developing these fibroids. Taking alcohol, taking drinks which contain caffeine, are also exposing you to the risk of getting fibroids. How do we treat them? One of them, you can use what we call hormonal contraceptives. Use contraceptive methods which contain hormones. 2, we can use what we call antifibrinolytic drugs. 3, we can use them non-steroidal drugs and agents. They can also help in treatment of these fibroids. Another one we can use what we call gonadotropic releasing hormone agonists. They shrink these fibroids, but they have a tendency of coming back after you leave treatment. When you leave treatment, they come back. So procedures, which procedures can we do on these fibroids? One of them is what we call endometrial ablation. You insert a tube in your uterus via your cervix like this. Then you put a medium. You can say cold or heat to kill this layer. 2, we can do what we call endometrial embolism. By putting a catheter, we insert a catheter in your arteries and we cut off blood supply to these fibroids. we can do another one, which is MRI guided ultrasound. We use ultrasound to kill these fibroids. We can use what we call, we can do a myomectomy. We insert a pipe here and we extract these fibroids directly, but they have a tendency of coming back. And lastly, we do what we call hysterectomy, that is removal of the whole uterus when they become